Anderson College is one of Canada's oldest colleges, having opened its first location in 1885. Anderson has trained over 100,000 students during its over 140 years of history and continues to be an empowering partner for those who are experiencing career challenges and transitioning to the next phase of their lives.
I consider myself a lifelong learner. So I've had education throughout my career in different programs, and I feel that by teaching students, I'm able to impart my education to these students to make them a better human being in the healthcare field. They start off for approximately 3 months of soft skills, as we like to call them. They do Microsoft Word, Excel, PowerPoint, and introduction to computers. And then they move on to the core. The core basically encompasses basic training for medical terminology, which is an absolute asset when they're working in the field. So medical terminology, approximately 10 weeks. They get transcription, they get medical billing, which is basically in sync with OHIP ministry requirements. And then they got hospital procedures and clinical administrative procedures also. So there are different components and all of it amalgamates, and then they end up with a placement at the end of their course to give them real life experiences. We have 2 different programs. One is an online program, one is an in-person here in their core course. We basically train them for the vital signs, like the vital signs, blood pressure, pulse, respiration, temperature, all of that. And then basically the urinalysis, they'll do that, they'll get an overview of that. And then when they move from here to the placement, they'll be put into a clinical setting. So whether that's a hospital or a clinic, where they will get experience of a live setting, how a clinic works, how a hospital works, administrative duties. So they'll get hands-on training. They offer the capstone option. The course is the same, the theory portion, but then at the end, they'll get a 1-month syllabus and they have to complete assignments, clinical assignments. So clinical scenarios, and they would have to write essays mimicking a clinical environment. With experience, they can go to public health, they can go to the ministry, OHIP, they can get jobs in any place where there's paperwork linked to healthcare.
When I entered here, the engagement with the help of my professor, that's the teacher, engages so much that you see yourself in the course.
I never think twice to take this course from Anderson because I have very good experience when I am doing the past course.